take a minute. The meeting has now started and I am admitting everyone. Good morning, everybody. This is Dominic Zerlo with the New Mexico Department of Health Center for Medical Cannabis and Psilocybin. We are going through and admitting everybody into the meeting. It does take a minute or so for everybody all to get in the meeting. In the meantime, I will just like to remind everyone we are recording this meeting and we do post the meeting on the website. So we do also ask that people ensure they are using appropriate language. It is also why, other than some of the Department of Health members and the board members, we do not have everybody on camera, and that is twofold. One, to ensure that individuals who are in areas of the state where they do not necessarily have the best internet, that they can stay on as much as possible. And when we have lots of video on it, that unfortunately creates too much bandwidth usage, and people tend to drop off more often than they sometimes already do, unfortunately. And so the other reason is just to ensure that there is nothing in the backgrounds that we cannot actually post up as part of the live recording. While that has happened in the past in some other meetings, thankfully not for this board or its committees, it has happened at other times, and we want to ensure that this meeting is as public as is possible. And so just have those as the reminders. For those who are still just joining, my name is Dominic Zerlo, and I'm with the New Mexico Department of Health Center for Medical Cannabis and Psilocybin, and this is the Medical Psilocybin Advisory Board meeting for February 27th. And with that, I will turn it on over to the chair, Ian Dunn. Ian, the meeting is yours.
Good morning, everyone. Good morning, everyone. Thank you so much for joining. I really appreciate all of your time. So I will call the Medical Psilocybin Advisory Board meeting to order at 9:03 a.m. And I'm really glad to see you guys here. So first things first, can I have the department pull up the PowerPoint?
In process right now.
Perfect.
Okay.
Alrighty, and then if you want to go ahead and go to the agenda, perfect, already on it. So again, welcome everyone. My name is Ian Dunn. I'm a nursing and psychology student as well as a mental health advocate. I'm the chair of the Medical Psilocybin Advisory Board. And since it has been since December, since we heard the original introductions of our other members, I'm going to go ahead and turn it over to them to just give us a reminder on who they are and why they're here.
So I'll go down the list just alphabetically. Brenda Burgard.
Hello, everyone. Thank you for having me. I'm Brenda Burgard, and I'm chairing the training and education for the Medical Psilocybin. I'm a mental health practitioner, and I'm also president of DCRIM for New Mexico.
Okay. Chris Peskuski.
Good morning, everyone. I'm Chris Peskuski. I'm chairman of the Propagation Committee and a veteran and a advocate and ambassador with the Rail Cards Project.
Thank you, Chris. Alana Dances.
Hi, everyone. I'm Alana Dances. I am the Medicaid director. Before this, I was the chief medical officer of Medicaid, and I'm a nurse practitioner, a practicing nurse practitioner, a primary care provider. Thanks.
Thank you, Alana. Desba.
Yat'e She'e Desba. I'm the chair of the Equity, Access, and Cultural Considerations Committee, and I'm here in Santa Fe.
Thank you, Desba. Larry Lehman.
Yeah, good morning, Larry Lehman. I'm the chair of the End of Life Committee. I'm a family and addiction medicine physician and psychedelic researcher and therapist at UNM. Good to see everybody.
Thank you, Larry. And Ian, I believe that is everybody on the board that is present at this time.
Alrighty, well, the agenda is on the screen. Do we have a motion to adopt it?
I motion to adopt.
Any seconds?
I second.
Second.
Perfect. Alrighty, and then I will, any objections to adoption of the agenda? Without objection, the agenda is adopted. So now I'm going to go ahead and turn over to the Department of Health to see if there are any updates from the program.
Thank you, Ian. And first, I'd like to make sure that we introduce our staff as well. And so I'll go through that list. So, and again, for those who may have missed in the very beginning, as the meeting was starting, my name is Dominic Zerlo, and I am the director for our center. So with that, can we go to Brenda?
Good morning,
Yes.
everyone. Brenda Martinez, that's okay. I'm the Deputy Director here at the Center for Medical Cannabis and Psilocybin.
Thank you, Brenda. Johnny?
Good morning. My name is Johnny Moucher, and I'm a management analyst.
Rob?
Good morning. I'm Robert Schruckner. I'm the medical director for the program.
Jorge?
Good morning, everyone. I am the Medical Psilocybin Program Manager, Jorge Gonzalez, here in Albuquerque.
Raymond?
Hello, everyone. Can you hear me?
Yes.
Awesome. Raymond Gallegos. I am the data and systems analyst for the program.
Thank you, Raymond. Adrian?
Hi, buenos dias all. My name is Adrian Estrada, and I'm a health educator for the Department of Health Cannabis and Psilocybin program.
Thank you, Adrian. Katie?
Hey, good morning. My name's Katie Freitag. I'm a health educator with the program.
Thank you, Katie. Carmen?
Good morning, everybody. Carmen Batista. I'm a health educator with the program.
Thank you, Carmen. Ismael?
Good morning, everybody. My name is Ismail Zuta, and I'm one of the health educators here in the program.
Kathy?
Morning, everyone. I'm Kathy Algeri. I'm IT project manager.
Thank you. Thank you, Kathy. Chris Woodward?
Hi, everybody. I'm Chris Woodward. I'm Deputy General Counsel for the Department of Health, and I'm the attorney who represents the Medical Cannabis and Psilocybin program.
Thank you, Chris. And that is all at this point in time. And so with regard to our introductions, and so, pardon me, actually, we do have one other individual. Miranda, would you mind introducing yourself?
Hi, good morning. I'm Miranda Durham, the Chief Medical Officer for the Department of Health.
Thank you, Miranda. I didn't see you sneak in there for a moment, but thank you for joining.
Having some tech issues this morning, so thank you.
Gotcha. Well, welcome to the meeting. And so with that, what I would just like to go ahead and do is, as far as an update for the program has been, of course, continuing to support all of the various committees for the board and starting to work on translating some of the work that has been done into the potential regulations. And that, of course, is what primary purpose of today's meeting is going to be looking at propagation, and we'll be looking at that outline to be able to see how that moves forward. And then we'll, of course, adapt from the decisions that are made here in the board. And then the other thing I just wanted to let everybody know is that we have been very successful in our hiring, and we actually have 2 new staff members who will be joining specifically on the psilocybin side. As many of you may have noticed, we had a lot of people from the department who are joining on in and who are supporting us, and most of those individuals have other positions and work that they're doing, especially with regard to the medical cannabis side of the program. And so right now, the only staff member that we actually have who has been dedicated solely to psilocybin has been Jorge Gonzalez, our program manager for the program. But starting on Monday, we do have Leslie Peterson, who will be our senior compliance officer position, and she will be starting, as I mentioned, on Monday. And then in 2 weeks, we will have our assistant environmental scientist who will be starting, whose name is Cyrus Rasmussen. And so he will be starting here in a couple of weeks. So that will really help us to be able to move things forward and to still meet the timelines that we have talked about previously with regard to having the first patients by December of 2026. which is, by the way, only 10 months away. So we have a lot of work that's going on, but that's essentially what has been happening with regard to the program side. We've been working diligently again with this. And I just want to make sure before we start going into all the other details and the updates from the various committees, I just want to say what a pleasure it actually has been to be able to work with the different committees and the amount of work that each of the committees is already doing. And so not just the board members who are chairing those various committees, but all the members of the public, of the future industry and the future providers who have been joining in and really providing such great feedback with regard to how things are progressing and with regard to what they would like to see, how they would see it, and how we can continue to reach out. Now, we do know because we've had limited staff members so far, but as you can see, we are trying to do this with as many people coming in from different areas as possible. And so we'll continue having the meetings. We are working on some in person. In fact, one of the committees, actually two of the committees, I believe, are in the process or have already set up some in-person meetings. And so just as a reminder, to see all of the meetings that are coming on up, if you go to our main website, and we'll put that in the chat in just a minute, you can actually go there and see the list of the meetings in date order of when they're going to occur and how to join those. So with that, I will turn it back on over to you, Ian, for our next set.
Yeah, so I will actually go ahead and also turn over to Chris. His committee has been working on, or not quite yet. Sorry about that. Let's hear an update from each of the chairs of the committees, and then we can go ahead and work on propagation. If you could roll call the chairs, thank you.
Sure. Again, I'm going to go down through the list of how they are on the system right here, just because it's easiest. So Brenda, would you like to give an update for your committee?
Yes, I haven't had much of an update since the first meeting because my next meeting is next Friday. However, it looks like we did do a lot of work in that first meeting, and the document was posted up there, and then there wasn't really much to do on there. We had really good input from the get-go. It was like, really good ideas and comments that were given in that first meeting. So the second meeting, I would just like to go over some of those things just with a fine-tooth comb and see if there's anything else that anybody would like to comment or add to the document, if at all possible. Anything new happening with psilocybin in the news or anything like that. All are welcome in the next meeting for training and education.
Thank you.
Thank you, Brenda.
Sure.
Then we will go next to Desba. Desba, do you mind providing an update?
Hi, yes, so we've had 4 meetings. I'm sorry, I lost count. Mostly just because I'm trying to make sure that I'm targeting different parts of the community. Those who are working in the evenings and those who are working during the day. I wanted to make sure that we have access to everybody. I definitely would like to see more diversity of people in the committees. I really appreciate everyone's time who has come and attended and given their input. Generally speaking, a lot of what I've been hearing is, anything from incarcerated individuals, as far as the equity point of view, is incarcerated individuals, financial Medicaid, concerned how we're going to be using the equity fund that has been passed through the legislation, which I'm hoping at some point we can get to. But then also just hearing about from other people in other parts of the country, in Oregon, Denver, what their experience has been, whether it's been on the behind the scenes propagation or facilitation side, and then also with that access is on the patient side, and what that can look like. And just to reiterate that we are still kind of holding a little to have input from Native nations, and what that would look like. We were waiting for the legislative session to end, which was just a few days ago. So hopefully we're going to be able to get the tribal liaison involved with more community outreach, and hopefully we can schedule some more in-person input and really just kind of move forward with what that looks like for the communities, because it is not just cultural consideration, it is also rural. In different parts of New Mexico, we are one of the largest states, but then also what it looks like specifically for our people here, the ancestral wisdom. So I'm really looking forward to even more input, but it sounds like we have quite a variety of different, I don't want to say agendas, but just concerns from the different sectors, whether it's on the patient side, how that equity and access and cultural considerations is going to look like, and then also on the I don't know, the facilitator propagation side, and what that's going to look like with equity and access for them, paying for training. And so equity, access, cultural considerations has a lot of intersection with the other committees. And so trying to make sure that we create that framework that it is supporting all of the other committees as they move along and as we have those considerations moving forward.
Thank you, Desba. And then the next committee is going to be Larry Lehman. Larry, I'm bringing your slides up now. Give me just a moment. Okay, and the slides should be showing at this time. We'll give it, there we go.
Great. Thanks, everybody. Good to see everybody here. We've had 3 meetings so far. These are the scopes and responsibilities that we established, and we're kind of gradually working through through each of these. A lot of the focus of the last few meetings, and I'll give a little update in the next slide, has been looking at like, how is the care going to be provided? What are the role of therapists? What are the role of spiritual team members, chaplains, end of life doulas? You can go to the next slide. So our first meeting was, it was basically just to organize. Then we decided that we really needed to do some self-education and get ourselves all on the same page. So on January 22nd, Chris Caldwell, founder of ELL Psychedelic Care, came and talked, gave an amazing talk. Then just last week, Jen Clement, who's also a psychedelic chaplain, gave a talk on the role of spiritual care. We had a really good discussion with both of those. I'd encourage people who are interested to, when they're posted, there's a little delay in getting them posted. For instance, Jen's talk is not up, to look at those talks. I mean, I think people have found them really, really helpful. And then we have a few more coming up. March 20th, Death Doula presentation, James Brown, who's a PharmD on pharmacological issues. We're looking at some other potential areas to get more information, hospice-related issues, Indigenous perspectives, home care. And our current goal is to try by May to have a blended in-person virtual meeting where we can actually have like a little more of a conversation while still preserving access to people online. And then I think we'll sort of head into making more specific recommendations on each of the items. But I would encourage people on the committee, if you get a chance to look at some of the meetings, at least to watch the presentations. Thanks, everybody.
Thank you, Larry. And for those who, if for any reason you can't see the slides, I have put the information on them in the chat. So you can also see the list of guest educators that are planned. Okay, and so then Ian, if you don't mind, I'll go to you and we'll leave Chris with propagation for last. So Ian?
Yeah, so the Dosage Administration and Clinical Practice Committee, we've done a lot of good work in hearing from pharmacists, providers, and others on how to properly dose it, especially when we're taking into account the fact that we're working with biomass and not synthetic chemicals. So I think the discussion around it has been really good. Nothing formalized yet, just working on getting the numbers in agreement and how to work with biomass on that side. In regards to the Patient Qualification and Safety Committee, we've adopted a clinical support tier system where patients that would have other comorbidities who may need more clinical support when receiving psilocybin treatment have access to that. That could include risk mitigation, that can include stabilization and other factors to ensure that when they are using medical psilocybin, they are in a safe space physiologically. And we are currently working on what conditions warrant what clinical support. So it's been a really good discussion.
Thank you, Ian. And so then at this time, we will move to Chris Peskuski with just a general overview with regard to propagation. And then Chris, when you are ready, I will display the outline.
Thank you, Dominic. I think you can probably start pulling it up. The propagation committee has meetings, I believe, and we've had a range of attendance from 10 to 30 attendees plus program staff. And so it's been just a really successful community proposal that we're making for our first draft recommendations. And I just am super grateful for all the people that have dedicated so much time to that process. And I know many of you are here today in this meeting, and so I want to thank you all. And yeah, basically, like I said, this is the first draft propagation framework, and I'm assuming you have it up, Dominic, although I still can't see it on the screen.
Yeah, I do. And I'm also going to put section by section as we go through them into the chat. So I'll start with the first section, which is purpose and scope. Would you like me to read through them, Chris?
Yeah, and I guess I have a question for Ian too. Are we just gonna go through this section by section and pause for comment on each one?
So I'm gonna treat it like you're the sponsor of the recommendation. So he'll read a section and then you can kind of give your thought process behind why you support that piece of regulatory language. And then we can talk about it as a group. Does that sound good?
Yeah, I wouldn't say this is in regulatory language though. At this point, it's all pretty plain language. And from my understanding, as this goes through the process, the Department of Health will put this into regulatory language. Is that correct, Dominic?
Yeah.
Yes, that is correct, Chris. And so what you're seeing here is really that framework and the outline for it. And then the department will take this and actually convert it over into the regulatory details and language and make sure that it's actually correct with regard to the spirit and intent. Okay.
Excellent.
With that, then, so this first portion is purpose and scope. Establish a regulated framework for the lawful propagation, production, testing, and preparation of psilocybin products in New Mexico. Emphasize public health, safety, consistency, and traceability. Minimize duplication by utilizing existing state, county, and municipal licensing and inspection authorities.
All right, so this is the bare basics. It's just telling us, what we're doing. Essentially, the propagation committee looked at everything from growing the mushrooms to getting them into the hands of facilitators and came up with this first draft going into this meeting. So any thoughts on section 1? All right, Dominic, will you read section 2, please?
Absolutely. Section 2, authorized species. Whole mushroom fruiting bodies shall be harvested for use in this program. Mycelial biomass products are prohibited.
So after lengthy discussion in committee, and I reached out to people in Oregon and Colorado to kind of get an idea of why they chose the species they did for their programs. We decided to not limit the species for this program, and but we are limiting it to whole mushroom fruiting bodies, restricting the use of mycelial biomass. And I can kind of get more detailed if anybody would like on that.
This is Miranda. I don't know if it's inappropriate to ask now, but if you could just explain what mycelial biomass products are, or, you know, at some point, will there be definitions in the document?
I'm sure the mycologists are going to tear me up on this for describing it the way I am, but essentially the fruiting body is the mushroom, what we know of, right? And then the mycelial biomass would be like the roots, kind of. And so it is the substrate with the mycelial network included.
Okay, thank you.
Yes. Are there any other questions on why we decided to not limit the species?
And again, I don't want to torture everyone who probably knows this already, but I guess, I mean, this sort of makes sense to me, but why, when you say why you made the decision, like, what are the reasons that you don't use mycelial biomass versus whole mushroom?
So it's hard to separate the mycelial mass from the substrate that you're using. And you can grow mushrooms in a variety of substrates. We didn't limit that. And so, for example, you could grow it in a substrate with, you know, pasteurized manure. And then if you're then taking that mycelial biomass and putting it into some sort of product, it creates a lot more testing issues. And yes, that's why we decided to limit it to the fruiting body only for those products.
Makes sense. Thank you.
Yeah, and if I could piggyback off of that, it's the difference between like harvesting a spear of green onion versus just harvesting the roots. Whatever the roots are in, it's gonna, like you said we were gonna tear you apart. You described mycelial biomass very well. But yeah, it's basically the roots. So you're gonna pull up a lot of, if it was, let's say, dirt, or if it was manure, or if it was whatever, it's gonna end up contaminating.
Got it. Thank you.
And just to add on to that, and you can see this in the mycelial advertising wars between Rise mushrooms and all kinds of other stuff, that, oh, our product has, you know, fruiting bodies versus what could be misconstrued as helpful and beneficial. So it's also just, you know, you get more bang for your buck, I guess, essentially. The medicine is in the whole fruiting bodies. It could not just the contamination, but it could it interferes with the I guess the medicine. not the medicine itself, but it interferes with the weight of like what is the actual medicine in the fruiting body versus like you're getting mostly dirt.
Thank you.
Any other questions about about section 2? All right. Can you move on to section 3, Dominic, please?
Yes, indeed. So permit structure. There are actually different parts with this. So I'm doing permit structure A. This starts with permits issued by the department required for production, which includes cultivation, harvesting, processing, for example, homogenizing, and packaging. And applying persons can apply for one or any aspect of the permit, demonstrate psilocybin containing mushrooms, products are kept in secure location. And just as some examples of how locations could be secured would be with double locks, video surveillance, surveillance, alarm system, commercial grade locks, keypad entry, and other types of security issues. There was just a question or a note that had been made about making the language a little tighter. And then the reminder is just that this is the outline, and the language in the rules themselves will be a little bit more specific and cleaner, so to speak. And so we have that aspect. And so again, this is the permits issued by the department required for those aspects of production, and then that they have to ensure that items are kept secure.
All right, I think this section is pretty straightforward. This permitting process will not require, multiple layers of paperwork if people are doing, multiple things within this process. So it'll be like a checkbox system. So if you're cultivating, obviously you're probably going to be harvesting and then processing or packaging in some way. And so you would just click the additional production permits that you need, and permitting would not be, there would not be an additional fee for permitting, which Colorado has run into some significant issues with the high, I think they do licenses up there, so licensing fees. And yeah, so there will be no permitting fees. There will probably be inspection fees or other things as required through the process, but no permitting fees. Any questions on section A of, or yes, subsection A of section 3? Ian.
Yeah, so I was just curious about the separation of cultivation and harvesting, just because I'm afraid of someone applying for like a cultivation license and then not being able to harvest because they're distinct. That wouldn't happen. I saw Dominic shake his head.
Yeah, Ian, those are just the different aspects that are included within production. It's not necessarily that someone's going to say, oh, we're going to cultivate and then, but we're not going to harvest. So that's just outlining that they're all there, if that makes sense.
So those are activities, not specific licenses.
Correct. Right.
Okay, cool. That's perfect for me.
All right, if there's no further comments, let's go to subsection B.
Now, here with subsection B, Chris, I'm not including in the text yet the sunset clause. I figure we'll tackle that separate. So with this subsection B, business facility and occupancy compliance, proof of ownership of the land facility or written approval from the owner, for example, lease specifying use to include psilocybin cultivation or production, business license in the state of New Mexico, proof of registration with New Mexico Secretary of State, registration with New Mexico Tax and Revenue, local building and safety authorities such as certificate of occupancy, fire code compliance, electrical and HVAC inspection. And just as a note, no new psilocybin specific building standards unless explicitly necessary. And just to sort of comment on all of that together with regard to the local building and safety authorities, those can actually be different in different municipalities and counties. And that's why we are just ensuring that anybody who is applying for a permit understands and realizes that depending where in the state they are, they may have some other local permits or licenses that they need to acquire, but we're not, as a department, not imposing additional ones upon them.
Okay, this is all pretty much boilerplate stuff to do business in the state of New Mexico already. We didn't really add anything in there. We tried to keep regulatory restrictions on cultivators as minimal as possible to allow them to operate as freely as they can and to be profitable. And you'll see later on, we put some safety guardrails in place. at the next level. Any questions on this section? And we will come back to the, when do you want to come back to the sunset clause, at the end, Dominic?
Yeah, I would suggest we do that at the end.
And then I also would like to potentially bookmark a spot for predatory financing language. Is that going to come out with the next draft, do you think, Dominic, or are we going to?
We actually have some language for that we can bring up. And we can do that together with the residency. Sunset. Okay.
Any
Okay,
questions
so
on subsection B? All right, let's move on to section C, please.
So with section C, zoning and municipal permits must be within the geographical boundaries of New Mexico. City and county planning and zoning developments, land use approval, conditional use permits where applicable, for example, City of Albuquerque raw food permit, food safety training certification for employees. And just as a note that local governments retain zoning authority consistent with existing agricultural, light industrial, and other classifications. Basically, this just really kind of continues part of that within from section B, really just talking about the fact that there may be additional items that a permittee or an applicant may have to do with regard to local zoning, but then also adds in the food safety, because since this is a product that is going to be ingested and as a medicine, that food safety processes should be followed.
Okay, I think this is pretty straightforward. Is there any questions on subsection C? All right, let's move on to subsection D, please, Dominic.
And subsection D is agricultural. The New Mexico Department of Agriculture, utilizing their pest and containment mitigation guidance, and that production is treated analogously to controlled environment agriculture.
Again, I think this is pretty straightforward. Are there any questions on subsection D? All right, let's move on to section 4, please.
So section 4 is cultivation standards. And please give me a moment while I copy that into the chat. Here we go. And then here, oh, my apologies, I am scrolling in the wrong direction. So with regard to this is about growth medium, that not to restrict growth medium, and all substrates and inputs must be documented, tracked, and fully disclosed in final product labeling. This actually references back to what Chris was talking about earlier, as far as the growth medium could be different products. And we want to ensure that that is listed within from a labeling standpoint and documented. So for example, and this was an example that did come to us from Oregon, where the substrate utilized was a wheat substrate, and where an individual who had celiac, which is an intolerance to gluten, did end up having a reaction to it. And so we want to ensure from an allergen standpoint that all of that is documented and tracked. And that's just as an example. And then environmental controls, indoor or controlled environment cultivation required, no pesticides utilized. And there have been comments with regard to including fungicides and other chemical agents and other substances determined harmful by the department.
Okay, so as Dominic said, we just want to make sure we're tracking what substrates are used, so that way if people have sensitivities, that we're not exposing them to something that they don't, want. If people are concerned about their mushrooms being grown in manure, they can avoid those products. And it's pretty standard, and it almost necessary in New Mexico to grow these things indoors. They just aren't very prolific here. And yes, we want to keep, so mushrooms are concentrators, And so we have to be careful, whatever we put into our substrates or use around these things, because they will concentrate that into the mycelial or into the fruiting bodies. And so that is why we expressly said no pesticides, and at some point want to have a banned substance list posted by the department of what you cannot use in this space. Any questions? Yeah.
Yeah, I do have a question about the fact that it says growth medium is not restricted. I know that we have in section B, you point out that other substances determined harmful by the department are taken out, but if growth medium is not restricted, does that put us at risk of, like, if they do use manure, that puts them at higher risk of E. coli and salmonella? And does that have any impact on what the department is able to say for growth medium?
I can answer that. Oh, Chris?
In the specific case of, if it's grown in manure, there will be testing for E. coli and salmonella as part of the testing protocols. And so that's one reason we decided not to restrict any kind of medium in this space. Did you have something to add, Dominic?
Yeah, I was just going to say that this is really just to say that we're not restricting growth medium from a standpoint of, the basis of it, but if there are individual components which end up being potentially harmful, those can still be banned at that point.
Thank you.
Thank you. Any other comments or concerns about section 4? Okay, let's go ahead and move on to section 5, please.
Okay, and so section 5 is harvesting, processing, and homogenization. Part A, batch definition, is a batch defined as harvested and homogenized under uniform conditions, utilizing best practices at no more than 1 kilogram after drying over a 4-week period. Batches must be fully homogenized prior to testing. The homogenization requirements, section B. Physical homogenization is required to ensure consistent potency across the batch. And the purpose of this is for accurate potency testing, reduction of dose variability.
All right, excellent. So I think we may need to look at the language a little bit on here. It says this part where it says 1 kilogram after drying over a 4-week period kind of sounds like we have to dry it for 4 weeks. But essentially what that's supposed to say is that they can inoculate a group of containers and harvest anything, in that batch. A batch is considered anything they harvest in that 4-week period. And so it can be in multiple containers, but basically the same kind of inoculating conditions. And then they are fully homogenized, which means the fruiting bodies are harvested and then ground up into a fine powder. And then that powder, a small section of that powder will be sent off for testing. Desba.
I'm just curious, would it help if we had a wet versus dry language in there? If that's what, if I'm understanding your, sorry. Yeah, would it help if you were saying, like, at the point, like, the weight is wet versus like when it's dry? Because is that what you're saying with the kilogram? That you're harvesting it wet at 1 kilogram, or is it, and then the resultant is a kilogram when dry?
So a batch will consist of 1 kilogram dried mushroom.
Okay.
Does that answer your question? And we can't homogenize wet mushroom.
Yeah,
What
definitely.
that would look like.
No, I know. I just
paste.
wasn't sure if there was like, if that was part of the issue, was trying to decide what was the 1 kilogram at the time of measurement after a 4-week period. Sorry.
No worries. Did I answer your question, Desba? I'm going to assume that's a yes. All right, Ian?
Yeah, so I just want to make sure I understand it correctly. So if I'm a producer, I can dry all of my mushrooms and then I can just batch them into 1 kilogram and then that gets homogenized and tested and all that.
Correct. But they all have to be the same, basically the same inoculation. So they have to be on a similar substrate because that has to be tracked throughout the process. And it has to be the same species of mushroom.
Cool, thank you.
Desba.
Sorry, another question, and I'm sure you probably discussed this, and I apologize if it's, so when we're defining the batch versus a flush, for a lot of us, some of us are, I think that might also be another.
So I'm sorry, Desba, I feel like I keep interrupting you. Are you?
Oh, no. I'm just wondering, like, when you're talking about a batch, I mean, I'm also new to this, so I don't understand fully, but like when you're talking about a batch, are you also talking about a flush? Because a flush is just like that one harvest for that one particular bin, right? So is that what you're talking about when you're talking about a batch? Is that just that one harvest from that one particular point? And all of the, you said inoculation, right? So all of these, if you had like 10 tubs or however, and you harvest all of those and then you weigh those and you dry those, right? That's what you're talking about when you're talking about a batch.
Yes, and so the flush is when you get multiple sets of mushrooms coming off of a tub. So you inoculate a tub, the substrate, it grows the mycelial mass, it fruits. You harvest the fruit, and then it'll oftentimes grow a second or even a third flush. And that's the reason why we allowed for the 4 weeks, so that cultivators can batch all 3 flushes potentially.
Got it. Okay. All right. So that makes sense. Thank you for clarifying that.
Yes. Is there any other questions on this section?
And Chris, just so that you are aware, what I've actually done is, as this conversation has continued, I've actually amended the language a little bit just to specify this is for fruiting bodies from the same inoculation, which have been harvested over a 4-week period. To clarify that aspect of it.
Yeah, I think that looks good. And then I don't think we'll need to add the substrate in there because that already needs to be tracked. So it's kind of assumed that each batch would have to be on the same substrate.
Yeah, the substrates again that'll be tracked just as you said.
Okay, excellent. All right. Any other questions on batching or why we did what we did? Excellent. Let's go on to section 6, please.
Okay, and just so everybody is aware, for this also has several sections. So I'm going to do section A first. And this is that regarding testing and quality assurance. Testing authority is performed by the department permitted laboratories. Requirements for laboratories to be permitted include cannabis testing laboratories, which have been approved and have submitted their standard operating procedures, and IDCs, which is their, and forgive me, I did not include it in here, but it is their initial determination of capability. It basically is making sure that they actually have the ability to perform the tests, and the process for extraction, and similar pathway for those who are not a cannabis testing laboratory, such as having ISO, IEC, or NELAC, NELAC-TNI, accredited laboratory, being one of those two accreditations or having those accreditations. And then again, labs that are approved or overseen by the department, which includes the state lab division. And especially with regard, the state lab division, especially with regard to potential testing and verification of other laboratories' tests. Ensure proficiency and verification testing annually, and that the department can require samples to be conducted by additional tests for validation purposes. That last one is about ensuring that, for example, if one laboratory, if there are concerns that their test may not be as accurate as they should be, then we could request that they be tested by a secondary lab to ensure that they are testing in valid and appropriate ways.
Excellent. Thank you, Dominic. Yeah, so basically this gives cultivators laboratories kind of three processes by which they can be validated through either the state lab department or through these two other verifying agencies, ISO or NELAC. And then the proficiency and verification testing annually, I think, is very important. So what that means is, like, every year we'll provide or all the labs will get like a homogenized sample of some sort, and they have to, like, hopefully come in within some standard deviation of each other on the potency and other verification results. Are there any questions on the testing authority?
Okay, Chris, I don't see any questions on the testing authority. There is a question that did come in the chat when I was reading that portion, asking if a cultivator grows as an example, two different strains, uses two different substrates, that we need to send in 4 samples for testing. And essentially, yes, it's based upon the inoculation, based upon this recommendation. And so, yes, if they were small, different substrates, different inoculations, then they would need to send in the appropriate samples.
Yeah, essentially that would kind of come down to the batching, and if you grow on a different substrate, it's going to be a different batch. If it's a different strain, it's going to be a different batch. Any other questions? All right, let's go ahead and go on to section B, please, subsection B.
So this next set is about testing, the required testing panels. And essentially on this, it is that testing occurs once the batch is homogenized. Cultivators must submit a sample of each homogenized batch and may be between 2 to 5 grams as required by testing laboratory sampling procedures. And just a note on that, that is recommendations that we did get from labs that are currently doing testing as far as those amounts. The product will need to be retested 1 year after the initial test date. The department can require additional tests if there are complaints, concerns, or in a random process. No cultivation or processing facility will be asked to test more than 4 times a year with regard to the random testing. This does not include if there are contaminants or false statements made by the organization, facility, or on the labels. Potency testing would be psilocin, psilocybin, including the 3 analytes, baeocystin, norbaeocystin, and aruginacin. Pardon me for my pronunciation. Contaminant testing would include microbial contaminants. These are just a few examples, including E. coli and Salmonella. And heavy metals, and again, this is an example, would include items such as arsenic, cadmium, lead, and mercury. It would also include testing for pesticides and fungicides, and synthetic terptamine screening upon request of the department in the event there's a suspicion of it having been added. And just as a note on that, that is just essentially we're looking at synthetics are not to be used by statute within this program for the medical patients. And so if that is added in, if there are synthetics added, we would have that screening if it is suspected. And then just a clause so that the department can stagger the implementation of testing as the laboratories are permitted and are able to provide validation of testing.
Excellent. Thank you, Dominic. Okay, so this is the most robust testing profile out of any of the 3 states that have a program so far. And I did that for 2 reasons, or we kind of set that up for 2 reasons. First, we want to make sure we're giving a safe product, and we allowed the cultivators a lot of room and not a lot of regulation on how they can grow. And second, because both Oregon and Colorado only have 1 operating lab right now, right? And so by increasing the amount of tests, not only are we ensuring we're giving a safe product, but we're also making it more financially feasible to have more than 1 lab, which I think is critical to having a working program here in New Mexico. So I'll open it up for questions.
And Chris, there is a question in the chat from Larry Lehman. Any rough estimate on what the cost will be for each batch analyzed? And I can answer that. If the entire listing were to be implemented per batch, it would cost somewhere between about $600 to $1,000. But mind you, those batches can be up to 1 kilogram, which is a lot of doses. So when you actually bring that across the various dosing, depending on what exactly ends up being with regard to dosing, we're only talking a few dollars per dose total.
Thank you, Dominic. Brenda.
Do we know how much time it takes between harvesting and testing? So the mushroom gets sent to the lab. How long does it usually take for testing? Do we know?
I can't answer that. Go ahead, Dominic.
Yeah, so Brenda, it's going to depend on various aspects such as drying. So how long the drying time will take, which will depend on what process the producer themselves actually utilize. But from the time of sampling, what the labs have really told us is it's really only a couple of days from when the lab samples. So a lot of the aspect of the timing is really going to be on the producer side of how long their processes take.
Thank you.
And that'll also be determined about when they homogenize. So they have, a month to harvest all those mushrooms, dry them, and then homogenize them. And then whenever they send that test in is kind of that batch date that gets applied to it at that point. Other questions? Ian.
Yeah, so with the synthetic tryptamine screening, and I could be wrong on this, is there any way that we could have limited GMO psilocybin? Because that is a regularly occurring tryptamine, but it would be synthesized in amounts greater than what would be found in nature. Is that any way accounted for, or does it need to be? I don't think so, but I just wanted to double check.
Chris, go ahead.
It's not something that came up in committee. Specifically, it's something I can take back and look at in the next draft if you want me to. But essentially, if we expect somebody is tampering with the amount of DMT, or adding something to a mushroom, then we can do that synthetic tryptamine screening, which pretty much screens for everything there's a database that's kept, and I think they use mass spec or something to weed out all kinds of different compounds that can be added to these substances. Go ahead, Dominic, if you have something to add.
You actually already said it, Chris, and it is, the only thing I'd really add is it's not something that from our colleagues in both Colorado and Oregon, they haven't really been seeing that as an issue.
And if people want synthetic tryptamines, all they have to do is go to the nearest head shop, and there's all kinds of funky stuff in the chocolates and stuff there. They're finding. So, any other questions?
Okay, and then the last section of this, and my apologies, I just didn't copy it in the last time round, is just on batch release. And really, this is just that all batches, of course, must pass required testing before they can be released for use. Okay.
All right, let's move on to section 7, please.
And section 7 is food preparation and product handling. And this is any conversion of raw material into ingestible or prepared products subject to food safety oversight. For example, environmental health, food safety divisions, and the food safety and handling training certification would need to be acquired, and no exemption from those standard food safety requirements. And this alludes back to the portion up above, just requiring that anybody who is applying for a permit ensures that they go through the appropriate food safety training, and in this case, that they actually implement it and utilize those processes.
All right, I think this section is also pretty straightforward, but any questions? Excellent. Let's go to section 8, please.
So, and section 8 does have a couple of parts within it. And so the first part, this is all under labeling, packaging, and traceability, or the tracking of products. So packaging, it must be sealed, labeled, and ensure the facilitator provides this information for the label and the product information for the patient. And just as a note, the next couple of sections actually have the elements of the label and on an additional product information document. Because, and just the reason I say that is some of these are going to be very small packages, and we don't need receipts or labels on them that are 10 printed pages long. So we have that as a separate document. But we'll get to that in a moment.
Any questions on section 8, subsection A? Let's move on to section B, please.
And section B is the label requirements and the elements itself. The label must be printed or affixed on the product package and include all the required information in a legible font, at least 8 points, be in English, although it may also be provided in other languages, be unobstructed and clearly visible. And it will include the producer's business name and permit number, the type of product, for example, homogenized fungi, species and cultivar name of the fungi, the net quantity of contents using metric system of measurement, potency of psilocybin analytes contained in the product expressed in milligrams and calculated using laboratory test results, total potential psilocin report. And this is where this is still being determined in one of the other committees, whether it be the total potential psilocin or the total psilocybin equivalent. and then also the total psilocybin equivalent. And then a logo designed and provided by the department that notifies a reasonable person the product contains psilocybin, no smaller than 1/2 by 1/2 inch. Unique identification of the product lot which is actually entered into the state traceability system that will be required. The expiration date and the statement, the risk, benefits, drug interactions, and effects of psilocybin are not fully understood. Individual results may vary. The statement, keep out of the reach of children. And the statement, do not drive a motor vehicle or operate machinery while under the use of psilocybin. And just as a note, Eileen, thank you. I, however, am sorry that we won't be able to help with the wallpapering project that you have with your very long psilocybin labels that you were hoping for. Thank you very much for injecting a little humor.
All right, so required label elements, I think most of them are pretty straightforward. Are there any questions on how we kind of came up with this? Any issues anywhere? All right.
Looks great. 10 of 10.
Sorry, was there a comment?
I was just saying it looks great. 10 of 10. That section is beautiful.
Excellent. Let's move on to section C, please.
There we go. Okay, and so here, this is the product information document. And so this would be a document available that lists the following information in English, either in printed or electronic document in 12-point font or larger. And again, this would not be attached to the product itself. It would be provided secondarily. All of the requirements for the product label would be included on this so that they can be matched. A statement regarding number of years the business has been established in New Mexico, and a statement declaring the state and county of residency, including length of time of the primary investors. Results of all laboratory tests conducted on the homogenized batch. Date of homogenization. Type and composition of the growth medium used, including type of grain, soil, compost, pesticides, and other inputs. Date of manufacturer or processing of the final product. List of all active and inactive ingredients in descending order of predominance by weight or volume. Growth medium used. List of potential major food allergens which might be contained in the product or in the growth medium. Identify the intended use and directions for use. A description of how the product should be stored. The following statement. This product is not approved by the FDA to treat, cure, or prevent any disease. The FDA has not evaluated this product for safety, effectiveness, and quality. There may be long-term adverse health effects from consumption of psilocybin, including additional risk for women who are or may become pregnant or are breastfeeding. And the New Mexico Poison and Drug Information Center phone. And my apologies, the pesticides was deleted. I accidentally had read it out in here, but that had been deleted because pesticides are not allowed to be utilized, as mentioned earlier. So my apologies on that. And then the other one statement, and we'll actually bring this up a little bit more when we talk as far as the residency clause, is just the statement regarding the number of years the business has been established in New Mexico. And it's a part of the larger conversation, so we'll hold on that. But regardless, we were planning on including this on this particular document simply because, as we did bring up, this seemed to be something that committee members were in favor of, regardless on the other residency aspects with regard to it that we'll discuss in a little bit.
I see Brenda has a question. Go ahead, Brenda.
I don't know if I've missed this or not. Is there an expiration date to the product here?
Yeah, that's actually on the label itself. And then the document information repeats everything on the label.
Okay, thank you.
Oh, and there's a question in the chat about adding suicide crisis hotline, the 988 number. I think that could be added without any issue. Does anybody? Is that?
I think that's a good idea.
Yeah, okay, we will add that on in. Thank you, Eileen.
And Ian, did you have a comment?
It totally slipped my mind. Sorry about that.
No, thank you. All right, I think let's move on to subsection D rather.
Subsection D is about the traceability or the tracking that we will do. And this is utilize an online tracking system as required by the department. This would be end-to-end batch tracking from cultivation through final product. Steps for grow, harvest, processing, testing, transport, and/or sale. And then records retained for a defined regulatory period, for example, 5 years.
All right, so this would be pretty much a basic tracking software, just like is used in the cannabis industry. People will, or providers of that software will be, will have to provide the basic necessary requirements for free, and then they can have add-ons for, for other perks and bells and whistles in their software that you can buy. Are there any questions about traceability and tracking? Excellent. Let's go on to section 9, compliance, please.
Okay. And for compliance, the compliance authority would be with the Department of Health. And then with regard to only their applicable permits, the New Mexico Department of Agriculture. And then local building and health department or inspectors with regard to their local permits. There would be clear corrective action pathways prior to license suspension or revocation. And just sort of as a little bit of an explanation, for example, say the department went in to do an inspection of a facility, we discovered pesticides or mold or other things that were growing and unsanitary conditions, then we would be issuing, for example, what is called a notice of contemplative action. They would have time to be able to correct that. If they did not correct it, and upon reinspection, then what would occur is then the action would be acted upon. So whether that be through permits being pulled or suspended or through other means as necessary until they have actually corrected the issues or the problems, and then move forward with regard to that. Also, there would be an appeal process that is pretty standard, and it is actually something that we did develop originally under the cannabis program when the Department of Health was actually was regulating the cannabis grow sections and cultivation. And so we would be using similar processes with regard to that, which are fairly standardized.
All right, any questions about compliance? Excellent. Let's move on to transportation, please.
Okay, transportation needs to be done and completed in a safe and secure way that it ensure that the contractors, for example, can meet with others or allow for pickup so long as there is a chain of custody form. What we're talking about on this is that either the producers or the practitioners, so the facilitators, would be able to transport as necessary and needed to go between the production and the facilitation of psilocybin being administered.
And another thing that this allows is it allows, say, a producer and a facilitator to meet somewhere and arrange for a pickup in that location, being New Mexico being such a vast state. That is one piece of feedback I got from people in Colorado, that transportation costs were high due to producers having to drive long distances and stay overnight, things like that. Any questions on transportation?
Okay. And then the last section, as far as for these types of items, is the future expansion and review. And this really is just providing that this is a framework that is designed to be scalable. So as there are additional laboratories, producers, facilities, that this would work with regard to that. Periodic review for scientific development, public health data, and operational performance. For example, the idea as far as for the testing, if there are additional potential contaminants that start to come into play, we would be able to add those kind of items on in. There is a question there in the chat relating to the transportation from Mary Curry, specific regulations as a clinician facilitator for transportation. Mary, they would be the same, whether it be a producer or a facilitator, which would include things such as making sure that they're secure, safe, those sort of things with regard to transportation. Okay, and with regard to the future expansion, I think that's really just that we ensure that the regulations are actually open so that they can be scalable. And I think as this outline shows, I believe that they are.
Awesome. Any questions on section 11? Okay, let's move on to section 12, please.
And actually, Chris, section 12 are the definitions, which we actually are following some of the legal definitions, some of which are in the statute and moving forward. So I would actually ask and recommend that the definitions not be adopted here, just simply that those will be a part of an ongoing, as the various rules and regulations for the different aspects, different definitions will kind of come to the front, and some of these may need to be amended as some of those other sections are created.
All right, sounds good to me. I think I'd like to give the board a chance to go back and revisit any section or subsection at this time, having been able to sit with it for a while. Are there any questions about anything that we've gone over?
I don't have a question. I will also side with striking the definitions, if that is necessary.
I'm sorry, I might have missed. Why would we strike the definitions?
Sorry, Alana, what we're going to be doing is as the various regulations are being done, the definitions are going to be created through the department. Some of them are actually statutory, and some of them may need to be amended as other sections are created. And so we're just asking that, you know, the department be able to actually create them and to kind of go from there. But we will look at, and we are utilizing some of the definitions that have been provided. We are looking at the ones from Oregon, from Colorado as well, so that we can ensure that they fit within our framework. Some of them work very nicely, some of them do not, because they use different language within their statutes than we do, for example.
Okay, that sounds reasonable. Thanks.
All right, that completes my presentation of our first draft. I'll turn it back over to you, Ian.
If I may?
Yeah.
We do still actually have the residency. Would we like to go through everything else first and then maybe talk about the residency separately?
I'll leave that up to Ian. Do you want me to go into that now?
Sure, go ahead.
All right. Go back to the sunset clause information. So right now, and I think we have Chris Woodward here. He might want to jump in on this. We unanimously passed a recommendation for a sunset clause to protect New Mexico residents. And there is, I'm trying to find this section right now. I'm sorry.
That's okay. It is on
Page 2.
Sorry, here, Chris. Yes, page 2 has it.
Page 2. Oh, there it is. Okay. Would you like to read the sunset proposal, Dominic?
Yeah, so the sunset proposal, and this is again to be considered by the board, and that initial ownership or sunset clause from the committee. This is the language that was originally utilized within the committee. If the application is a corporation, limited liability company, partnership, association, trust, or other legal or commercial entity, ownership requirements, more than 51% of the ownership interest in the applicant must be held by one or more individuals who have been residents of the state of New Mexico for a minimum of 36 months immediately preceding the date of the application. And B, control requirements. The individuals described in subsection A must possess actual authority to direct the management, policies, and operations of the applicant, whether through voting rights, management authority, contractual rights, or other indicia of control, as determined by the New Mexico Department of Health. Notwithstanding any other provision of law, and until January 1st, 2029, an applicant for a license subject to this measure must demonstrate compliance with the residency and ownership requirements set forth in this measure.
All right, so this was unanimously accepted as a proposal through our committee. And then there came into some question whether this violated interstate commerce laws. But after talking with consulting some other lawyers from the Healing Advocacy Fund and another law firm, they say that it cannot violate federal interstate commerce laws because this substance is federally illegal. So I'm not sure where the Department of Health lawyers stand at this point, but once again, this was a unanimously approved recommendation. And it, we think it's important to protect local cultivators. So I would ask that the board stand with us in approving this as a recommendation, and kind of give the Mycology Guild room to continue debating that with the Department of Health's legal team. Any questions on that? Ian.
Yeah, I really like the idea of having New Mexico interests represented first, especially for those first 3 years while the industry is taking off. My biggest concern is that we are a medical advisory board, and this seems to be an economic regulation. So I'm not sure if we have the authority to economically regulate this aspect of the program. But I do really like supporting our local businesses, and if this does turn out to be possible, I would really hope to vote for it.
I disagree. I think the economic feasibility is inextricably linked to the success of this program in its entirety. So I think we can make recommendations on how the entire program is set up. That would be my opinion. Can we go to Chris Woodward, please?
Hi. So I'm Chris Woodward. I'm an attorney with the Department of Health, and I had met with Chris and Victoria. I'm sorry, I'm forgetting her last name, and some of the program folks about this issue the other day. So first of all, I do think that the advisory board can make a recommendation about this, and I think that you can make a recommendation about a financial issue. I will say that residency requirements are problematic, and while I understand the argument to say that that because this is psilocybin, Congress didn't contemplate anything in the way of interstate commerce, and therefore the Dormant Commerce Clause doesn't apply. That's not sort of the majority opinion right now. There's one opinion that came out very recently in the Ninth Circuit that says that. I would just say the Ninth Circuit is the most overturned circuit in the United States. I think something like 93% of their cases that go before the US Supreme Court get overturned. So I don't put a lot of stock in it. Of course, we're in the 10th Circuit. There have been a couple of other circuits that have considered the question in the context of medical cannabis programs, the First Circuit and Second Circuit, and they both went the other way. And I would just add also that I don't think it's just a dormant commerce issue. So if the dormant commerce clause applies, then you have to apply strict scrutiny, and there's no way that it's going to survive strict scrutiny. So I understand the emphasis on saying dormant commerce doesn't apply, but I think what is likely to happen now in the Ninth Circuit is that you're going to see a lot of case law where instead of arguing about dormant commerce, they're going to be arguing about the Privileges and Immunities Clause. And you're going to see people who are negatively impacted by this suing the state for monetary damages, and perhaps successfully under the Privileges and Immunities Clause. That's something that you can sue over in a 1983 suit and potentially get monetary damages over. And of course, that sets, I can't recall the exact standard, but it's something like a substantial justification. And the problem that you run into with these types of residency requirements is that at best, they're only kind of loosely connected to what you're trying to achieve. So for example, I'm a New Mexico resident. So I would be permitted to grow psilocybin in the state if there was a residency requirement. Do I not have the same incentive to grow mushrooms to grow psilocybin in Colorado and bring it across state lines to invert? I do. I have the same incentive. Arguably, I have less in the way of an option because maybe I don't live in Colorado, but if I'm a New Mexico resident, does that mean that I don't have a grow facility in Colorado? No, it doesn't. And so I think that's the real problem that you have. And that's why you can't satisfy a higher level of scrutiny on this. Maybe you can get past rational basis, but certainly not strict scrutiny, which in this case would ask, is your requirement narrowly tailored to achieve a legitimate state interest? We can't meet that standard. And for privileges and immunities, you'd have to meet a standard of a substantial justification. I don't think we can meet that standard either. So while I understand, it's perfectly fine if the advisory board makes a recommendation in favor of this and it's within your discretion to do so. Ultimately, the Department of Health is going to have to make a decision after the rule hearing. Of course, we'll receive public comment on it. But I think at least as far as a residency requirement goes, it's probably not going to happen.
Thank you, Chris. Desba.
The legalities aside and laws, et cetera, and restrictions, I'm just thinking that this could potentially be a part of the access portion, and what that is specifically for New Mexicans, just from a more broader advantage point. So it would still fall under like us having a recommendation and not sidestepping it.
Thank you. And yes, again, I understand there's legal scrutiny on this, but I propose that we still make this recommendation and allow that conversation to continue between the legal team with the Department of Health and the Mycology Guild. Any other questions? All right. At this time, can we take a look at the predatory I'm getting an echo. Can somebody mute, please? Can we take a look at the predatory financing language, Dominic?
Yes, let me bring that on up. Please give me a moment. It's actually in a separate document. What essentially we have been looking at this was one of the questions that was raised that was actually a little bit more concerning even than that with regard to this conversation about the financial ownership within New Mexico. And let me pull up. And I will say Chris Woodward was very good about creating some language with the help of some of the folks that we had met with, including Victoria Civitanovich, who joined with us in that. And so this is a little bit lengthy, and so I'm going to do this. So give me just a moment, everyone. My apologies. I'm again, like I said, I'm pulling it out of another document. There are some notations in here just because the document itself, that Chris had done, has his notes in it. But here we go. And so essentially what this does is it says that a permittee shall comply with all applicable state, tribal, and local laws, regulations, and ordinances, including requirements concerning agriculture, environmental health, building and occupancy, fire safety, zoning, and worker safety. Dual ownership prohibited. A person who holds an ownership interest in a permittee shall not hold an ownership interest in any other permittee. Permits non-transferable. Permits shall not be transferred by assignment or otherwise to another person. A permit that is transferred to another person shall be invalid. An applicant or permittee shall not convey actual control of the applicant or permittee to another person through the use of a management, consulting, or intellectual property agreement or by any other means. Nominee, straw, and proxy ownership prohibited. If any ownership interest in the permit is nominal or without the benefits and risks of genuine ownership or control. And then record of financial interests. Permittee shall create and maintain complete lists of all individuals and legal entities that hold a financial interest in the permittee or the operations of the permittee, including contact information for each individual or entity and a description of their financial interest. Applicants and permittees shall provide the information required by this section to the department within 15 calendar days of the department's written request for such information. If a legal entity holds a financial interest in the permittee or the permittee's operations within the medical psilocybin program, the following individuals within the legal entity shall be deemed to also hold a financial interest. A, for limited partnerships, each general partner in the limited partnership. B, for limited liability companies, each manager and managing member of the limited liability company. C, for-profit corporations, each principal officer of the corporation. And D, for nonprofit entities, each principal officer of the entity. And then Chris Woodward, do you mind just explaining a little bit what nominee and straw proxy ownership is?
Yeah, I mean, I think just to give an example, and this came up in our conversation with Chris and Victoria the other day as well, and it sort of prompted some further review. Some of the language that we've come up with so far, what Dominic was just describing, some of that language is taken from what Victoria sent us. Some of it is taken from other states. So I think some of that is from Maryland and some of it may be from Missouri. But on the subject of proxy arrangements, straw ownership issues, this was something that you would see sometimes in the medical cannabis context, where you would have people who would sort of pretend to be the owner, but they're not really the owner, and the people who are actually controlling things are other folks. And so you get into issues there where, for one thing, you just don't really know who's controlling the entity. So that in essence is what that's trying to prohibit. The kinds of management arrangements. It was very common in the medical cannabis program for these producers and other licensed entities to have what they called management agreements, where they would enter into, they would officially be the owner of an entity, but they would enter into a contract with someone else where they basically just agreed to do everything that other person said to do, which for obvious reasons is really problematic. So the language that Dominic just described would address that.
Thank you, Chris, and thank you, Dominic. And I just wanted to be clear that the predatory financial language did not come through the committee. That was a kind of a side meeting that we were continuing the discussion about the sunset clause through. So.
Dominic, if I may, so on the subject of predatory financing, the language that Dominic just read off doesn't really address like loans, and I mean, at least not in terms of, I know what Victoria had proposed was more along the lines of the agency almost like reviewing loans and approving loans and that sort of thing. At this point, we're not proposing that. And I think the concern there, and Dominic, feel free to jump in on this, but I think the concern there is that it would be a lot of work for the program and kind of overbearing as well. And I think maybe more to sort of the core issue, if your concern is that the use of predatory loans, if at the end of the line, the issue is that by someone using a predatory loan, they will eventually be able to acquire ownership of the entity, then perhaps it's not as critical to review all of the loans, so long as you have provisions such as what Dominic just described, where you're basically saying you just cannot transfer a permit, you can't transfer ownership. Presumably, with a requirement like that in place in the law, lenders are not going to lend you money on the basis that eventually ownership will transfer to them, because it will be clear that ownership cannot transfer to them. So I hope that explains that. But again, it's kind of an ongoing process, and as the department receives more comments about this, maybe there will be some tweaks to that. I'm not sure.
Thank you, Chris. All right, are there any other questions or comments? Excellent. Then I'll go ahead and I'll turn it back over to Ian.
Perfect. Thank you, guys. So we have two options. We can defer to the voting on this until the next meeting and allow us to hear public comment first, or we can vote on it now. Whatever the board members feeling like.
Ian, if I may, I would recommend voting on this today. Even if you do decide to hear a public comment, I think there's been opportunity for people to comment on it at this time. And just as a note, when the final regulations are actually created and submitted, there is a 30-day period where they are open for public comment. So even here at the board, it is not the last time that they, that there's voting or comment allowed, so to speak, if that makes sense.
Perfect. And then Chris had his hand up.
I think Dominic answered most of what I was going to say.
All right, then we will go ahead and move to a vote. If you want to pull up the hand raising screen for me. All right. So. All right, so what I will go ahead and do is, if the board members are in support of passing the propagation outline with the definitions striked out, please raise your hand at this time. Of those attending, there is unanimous consent to adopt. Perfect. If you could all put your hands down. Ceremonially, if there's anyone in negation, please raise your hand at this time. Perfect. The motion is adopted. The propagation outline is adopted with the definition striked out. Alrighty. So that looks like that was what we had on the agenda today. Is there any other business you feel we need to get to before we turn to public comment? All right, I will turn it over to
do we know when the next
sorry.
meeting is?
You are right. We need to set the next meeting. Thank you so much for that reminder. So we can do in another month, if you guys want, we could do March 20th or 27th if you wanted to do another Friday, but when works best for y'all?
The 20th in the morning works for me.
Like 9 a.m. or earlier?
Either way.
Then
9
let's
a.m.
do the 20th at 9 a.m. Everyone good with that? No objections? Cool. 2026. Perfect. All right. Oh, Chris has his hand up.
Yeah, so I do have a question for the board. What would you like the propagation committee to work on next? I have 2 more meetings set up. I kind of expected for the parts of this may have gotten kicked back to committee, but seeing that this has been adopted now, what questions do you all have for the propagation committee?
Chris, Ian, if you're okay, I actually have some information on that. So, Chris, what we are hoping is that by the time the next meeting is happening, that we will actually have some drafts of the regulations. And so I would say that those meetings can actually be utilized to look at the drafts that we have created as a department and help us with regard to that.
That sounds good. Are there any other questions the board would like the propagation committee to answer? Go ahead, Desba.
I just had a question for Dominic.
Sure.
Oh, so I just wanted to know if we had an update on the equity fund results of that in the legislation, and then also the tribal liaison, and then it looks like some people are asking about when the next committee meetings or where to find that on the website.
Sure. Yeah, so I'd actually put earlier in the chat where all of the committee meetings are. We have both the website and we have the links for the meetings are earlier in the chat. We'll duplicate that here in just a minute. As far as for the equity fund, thank you, Desba. We usually wait until the governor has signed, but what essentially has happened is the legislature did pass $630,000 allocated towards the equity fund. And Larry, correct me if I'm incorrect on this, but I believe it was 300,000 to UNM directly for research. Is that correct, Larry?
Excuse me, Dom. That's correct. It's in a couple of different batches, but it amounts to 300. And we talked, it's for end of life research.
Yes, and so both of those are now have moved forward to the governor's desk for signature. And so once we have that signature, then we'll see what happens. Of course, always as a reminder, the governor does have the ability to veto, which is why we usually don't announce that until after signature. But in any case, that is there, and that is going to be something that, especially for the committee that you're chairing, Desba, is going to be very important as we start looking at what are going to be the requirements for people to be eligible for some of the funds out of that. And I think that's going to be a fantastic task, quite frankly, and one that we're very happy and looking forward to tackle.
Thank you.
Some of my team have actually already put in the links within the chat for all of the upcoming meetings.
And then Yeah, so we're imagining MLG signing off on that.
I do not speak for the governor. However, what I can say is I do know the bill has already been submitted. So.
All right. With no other board members with questions, I think I'll turn it back to you, Dom, or Jorge for public comment.
Okay, and so at this time, if there are any members of the public who are interested in speaking, and I do already see at least one hand, the information on how to raise your hand is here on the screen. I will be putting it into the chat in just a minute. And then once you are called on, then you can go ahead and unmute yourself and you may speak. So, Adrian, I believe you are handling that aspect.
Thank you very much, Dominic. You are correct. First up to speak is Job or Job. My apologies for if I mispronounce that. Your microphone credentials have been enabled. Go ahead and unmute yourself, please.
Yeah, I got here late, so I do apologize. I just have a couple of questions. Would it make sense to facilitate a transportation service with the federal government that they would accept, and that would resolve all transportation issues? The second question is, do you guys monitor forever chemicals in the water that is added to the psilocybin? And the last question is, I'm actually looking to get into participating in the medical research as a patient. And those are my three questions.
Thank you. Next up is Jeremy. Jeremy, I've enabled your microphone. Please unmute yourself.
Hello, everybody. My name is Jeremy. I appreciate you guys giving me a chance to speak. I just wanted to elaborate on the full fruiting body advantages that you guys will be focusing on. Basically, when you're dealing with the full body fruiting, or full fruiting body rather, you are essentially getting the highest diversity of bioactive compounds. Those fruiting bodies typically contain the full spectrum of secondary metabolites. Examples of those would be your various alkaloids, terpenoids, etc. Some compounds that are only expressed or maximized during fruiting versus the vegetative phase. So I just wanted to add that, your vegetative phase was mentioned as mycelial biomass. And this also, I believe, makes for clear labeling. You can label, something that's 100% fruiting body. So kudos to you guys for that. A downside of grain-grown mycelium, is that it can be up to 70% starch if it's not separated or fermented in a clean manner. So residual starch, as many of us know that are in the mycology community, is a readily available sugar source, and it, feeds bacteria and encourages yeast and mold growth, undesirables, So another thing I wanted to ask, I guess this question would be for Chris. Where are you guys at with insight for producers on lab procedure, when it comes to sterilization, aseptic technique and stuff like that? Are there going to be, MSDS sheets available for employees to protect employees, things of that nature? Because, those of us that do lab work on a regular basis, we're in constant contact with corrosive stuff. We're using bleach, we're using parasitic acid, 70% ISO, things of that manner. So I just kind of wanted to know where you guys were at with that. Thanks.
Thank you. And just a friendly reminder, if anyone else wishes to make public comment on the Microsoft Teams app, there is the raise hand or the raise icon with the hand, excuse me, and you can click or tap on that. So that way then the software will move you up, so that way we can allow your credentials to speak. And if you are joining through a phone, it is *5 to raise or lower your hand. And currently, because there is no hands up at this time, I will pass it graciously back off to either Ian or Dominic.
Alrighty. Well, given that there's a little under 10 minutes left and we have no more public comment, I say we go ahead and adjourn. Thank you guys all so much for coming. I really appreciate all of your time and help today, and I wish you all the best weekend.
On behalf of the department, thank you everybody for participating and for all the hard work that has gone into everything so far, and looking forward to the next sets of committee meetings. And again, we have put those meetings in the chat, and so if anyone is interested, you can also find them and updated meetings in the meanwhile, between now and the next board meeting. We do put those on the website, on the Psilocybin Advisory Board meeting page, and so that people can actually come and register and participate in all of the various aspects of the committees. And thank you, everybody. Hope everybody has a wonderful Friday. And don't forget, if you are interested, this afternoon is the dosage administration and clinical practice meeting starting at 1 p.m.